Hello, everyone. I hope you all are having a fabulous Sunday afternoon. It is indeed a great day, and it has been a great weekend, hopefully so for you. Thank you for joining me this afternoon, and I hope that you will find some very interesting tips about ADHD, understanding what it is and what it isn't. So, I am Dr. Brandi B, your triple board certified pediatrician, adult psychiatrist, and child and adolescent psychiatrist. Hello, Dr. Omarine. Thanks for joining. I help worried and overwhelmed moms and dads of children with ADHD gain knowledge and power so that they can do three things: help their children to become better students and make better grades, help their children to have better behaviors in and out of the classroom, and also to ultimately help their children to have a better chance at success in education and in life. Today, I want to speak to you for just a few moments, about ADHD, what it is and what it isn't. Of course, I am an ADHD specialist, but I am all things psychiatry, especially child and adolescent psychiatry. But today, I just want to speak to you a little bit about ADHD. There's a lot of buzz about ADHD, and of course, children are out of school now, so there may not be as much concern about ADHD. But a lot of parents are already preparing for and maybe even dreading what's going to happen when school returns in whatever format it does in August or September. And so I want you as a parent, a mama or a dad, even a grandmother, and I even have great grandparents, I want you all to go ahead and start thinking about ADHD now and what it will mean for your children, how it can benefit them. But before we can start talking about treatment, it's going to be very important that we understand exactly what ADHD is. So, a little bit about myself before I get started. I will let you know that I finished Vanderbilt University for my undergraduate education, and then I did my medical education at medical school at Meharry Medical College. Afterwards, I attended the triple board program at Indiana University in Indianapolis, and that is where I learned how to be a pediatrician, an adult psychiatrist, and a child and adolescent psychiatrist. So, a little bit about ADHD, as I said. What is ADHD? So, ADHD is a neurodevelopmental disorder. It's very important for people to understand that, yes, we as psychiatrists treat it mostly, but your pediatricians are going to be the first people to actually bring it to your attention, if not a daycare or a child's school. So it is a neurodevelopmental disorder, which means that there are neurologic components as well as developmental components. And so that means that it's just an unusual way of development, and that's okay. We have several things like that. So don't beat yourselves up, mom and dad, if you think that you did something wrong. Oftentimes we really cannot trace it back to any specific cause, but sometimes we can, and we will talk about those in just a little bit. There are three types of ADHD, and most people don't understand this, but I think it's very important that you know that there are definitely three types. What do most people think about when they think of ADHD? They think a kid who's running around, always on the go, cannot sit still, when in fact, there are three different types of ADHD. And in later sessions, I will go more into details about what they are. But for now, I just want to tell you this. There is an inattentive presentation where the children have a predominant symptom of inattention. And there are some unusual things that we typically don't think about as inattention, but something as simple as not completing a task or being forgetful or being disorganized or even procrastinating. How many of us procrastinate? So all of those can be symptoms that might suggest an inattentive presentation. There is also a hyperactive impulsive presentation. These are the kids that most people typically think about when they think of ADHD. So the kids that are always on the go, can't stay seated, blurting, interrupting, jumping, all the INGs, they are all over that. That is going to be your hyperactive impulsive presentation. And then your third type or presentation is going to be the combined presentation. So these are the children or adults that are going to have both inattentive symptoms as well as hyperactive and impulsive symptoms. So we will talk about that, as I said, more in details in future installments of this series. But for now, I just want to give you a taste. So it's not necessarily something that you can say, oh my God, my kid doesn't have ADHD, because he can sit and play the Xbox, I think might be what's popular now, an Xbox for 12 hours straight without eating or going to the restroom. And so to that, I will say there is a difference between fascination and concentration. Concentration is what it takes to read a book. Those words don't move, and they certainly don't make any sounds. Fascination, on the other hand, is what happens when kids are playing their video games, for example. Thank you to all of those that have come on. Dr. Omarine, Dr. Andrea, Toya. Oh, thank you so much. All right, so we know that there are 3 types. We know what they are. Now we will talk about the sex of the child who presents. So we usually see or think about boys having ADHD more than we do girls. In fact, what happens oftentimes, though, is that boys are more hyperactive. So boys usually get diagnosed with the hyperactive impulsive presentation, whereas girls usually get diagnosed with the inattentive presentation. So while the boys are jumping and flopping and jumping from who knows what and running around and talking, the girls are usually, they may be very talkative, but they usually can keep it together, sit in a seat, and that is dangerous academically more so than it is behaviorally. So don't forget that. Your boys are going to be hyperactive all over the place. Your girls may be sitting there still, but still not paying attention, and that's going to be very detrimental in the classroom. ADHD can affect all ages. I'm going to say that again. ADHD can affect ages. And I'll say it one more time. ADHD can affect all ages. So why is this important? This is important because as people get older, as people will, their ADHD symptoms don't go away. And so what we have are 18-year-olds whose insurance changes, or they just think I'm 18 and I'm not in school. And so what usually happens is these people go on to have jobs at factories, offices, they become professionals, or what happens to a lot of 18-year-olds is that they go to college. And so what happens in college? The volume of the work increases. And so now all of a sudden, children are not able to keep up. They had been able to smile at their teachers and get extra work, and their teachers knew their parents, and so they could turn it in a little bit later. Well, now in college, you have the volume of a college student, which is much more than that of a senior in high school. And your teachers, they may know you, and they may care about you, and they may even know your mom and dad, but it's about business. And so those grades are not going to be there even for the 18-year-old. Or you could be 30 and an executive or an executive assistant, but you can never get to work on time because you forgot something back, or you're just on time but unprepared. You don't have the necessary materials, or you are missing deadlines. These are all things, real life things that I have heard from people who have ADHD. And so the one thing you'll find about me is that I'm never going to suggest anything to you. You're going to have to ask me the question. You're going to have to come and see me in my office and actually ask me what may be going on. But meanwhile, I'm thinking this person probably needs at best, some help with organization, because that can really do the trick. So very important thing to know that ADHD affects all ages. Hello, let's see. Shakita, hello Cecilia, hello Mr. Gary, hello Kobe, thank you all, hello Della. Thank you all for coming on and joining me. I really do appreciate it. All right, so we're talking about ADHD, understanding what it is and what it is not. We've talked about the fact that there are 3 types: an inattentive type, or an inattentive presentation, a hyperactive impulsive presentation, and a combined presentation. We've talked about the fact that it is males more so than females, but you really can think about the fact that it's going to be males having more hyperactivity than girls do, and so it usually getting recognized and picked up quicker. Race and ADHD, whites tend to have it at about 9.8% and blacks at 9.5%, Latinos at 5.5%. I think that that's going to be in large part what you're probably seeing in your practice, who you're around. And so it always comes up that people will say to me, well, black boys are getting diagnosed more so than other races. I think it's important, though, for you to hear and understand that only 6.1% of people in America are being treated for ADHD. So since blacks are a minority, I would assume that that would mean also that we are being diagnosed for and treated at a lesser percentage than other races, but people do have their opinions about that. And again, my job is to not force anything on you. My job is to just educate you with hopes that you will do what is best for your child, what you know to be best for your child. And if your child is old enough, they can even tell you what's best for them. I'm kind of going off script a little bit, but I think it's important to interject here that ADHD is quite uncomfortable. Imagine that you are always on the go. You are always moving. And even if your body is not, your brain still is. That is quite uncomfortable, and it's also exhausting. But then when you get ready to go to bed, those same movements are happening, for sure with your brain, but also perhaps with your body. So a lot of times the adolescent kids or the older young children can say, Mommy, I just can't stop. I can't make my body stop. And so those children, they're going to be begging for help. They're going to wake up saying, Mommy, please help me. The other thing that can happen sometimes is that kids are very, very irritable. And so parents want to, call their kids oppositional defiant disorder. We want to call them anxious. We want to call them anything but ADHD. And I'm okay with that. I am not the forcing doctor. I am okay with whatever you want to call it. But a lot of times, if a kid is old enough to know that they had intentions of getting something completed, let's say, for example, you told them to take out the trash. They had the trash in their hands. They were on their way to the door with the trash. Their sibling had on their favorite TV show. They put the trash down. They are now in the room with their sibling, and they are watching TV. 2 hours later, you come in. You are furious because you've asked them to take the trash out 3 times now over 3 days, and it's still there. So now what happens is you say to them, why didn't you take out the trash? And they say, but I was, and so now everybody's frustrated. Everybody's on 10. They're on 10 and mad at themselves because, once again, the trash isn't out. You're on 10 and mad at them because, once again, the trash isn't out. And it's not that they were being defiant, although there is a high likelihood that they could have been. But what we need to make sure that we've done as parents is treated that which we could, which is the ADHD. If we can treat them to not be forgetful, and remember I told you that that was a key symptom of the inattentive presentation. If we can take away that inattentive tendency that they have, they can complete tests. And guess what? You aren't mad, so they aren't mad. And actually, they're feeling quite good about themselves. This is the child that you say, I've been looking for this child. Oh, Dr. Rudolph, where have you been? Where have you been? Because now I've brought the child back that you knew existed all along, but a lot of frustration and irritability has now driven a wedge between your relationship. So, ADHD affects all ages. We've already talked about that. The age of presentation. Age of presentation is usually between 3 and 6 years old. What's happening between 3 and 6 years old? Children are going to school. They're going to daycare. My children, for example, they all stay home with my mom. Thank you, Mama. They all stay home with my mom until age 2, and then they went to daycare. And so now I have one that's entering kindergarten, okay? And this is a good little nugget I'm going to insert here. When my oldest, who is now 5 and entering kindergarten in the fall, when he went to pre-K this year, the teacher told me actually at pickup, which was an unusual thing. I usually don't pick up the kids because I'm taking care of other people's kids all day, which I absolutely love. But the teacher said to me, Mrs. Bowling, Frederick fell out of his chair several times today. Now, in my mind, I know because I treat ADHD all day long and I hear the things that teachers complain about. And ADHD and falling out of a chair, is kind of code word for ADHD. So I know that this child does not have ADHD because he's now 4, has been in a, controlled environment for now 2 years, a year and a half at this point, and we've never fallen out of a chair. So when I looked into it a little bit more, in fact, they were going over things that my child already knew. So that is one of the things that we need to talk about, and we'll talk about differentials a little bit more. I'm going to try my best to give you as much education as possible about ADHD and about all sorts of things, because I want you to be informed. And so when you say, I still don't want to treat it, you can say, absolutely, I don't want to treat it, and I know why. I know what that lady said. I know what Dr. Brandi said, and she seems like a very nice lady. She actually even seems like she knows what she's talking about. But I am making the best decision for my child, and I'm okay with that. Hello, Shaniqua. Hello, Aaron. Thank you all for joining. So, presentation. 3 to 6 years old. Kids are going to school and daycare for the first time. It's a controlled environment. There are schedules that need to be kept. They need to stay in their seat. And yes, a kid who falls out of his or her seat all the time could be something that is concerning. But it is not, that does not mean anything. So, you need 2 points to make a line, and you need several points before you come to a diagnosis, and certainly before you start treating. So make sure that you are looking at all of the points. I will take this moment to talk about the differences in presentation as a child ages, though. So 3 to 6 years old is when a lot of kids come to me. There's this big boom at kindergarten. So if school starts up in the fall, about October, I'm going to be busy. And why is that? All these kids are in kindergarten, can't stay seated. They're talking too much. They're hitting kids. They're getting labeled as a bully. I will tell you, a lot of times, because of the impulsivity, kids with ADHD, they do then think. They saw somebody walking down the aisle, they tripped them up. They saw somebody walking down the aisle, they hit them. They, clucked somebody upside the head with a pencil. They did all of that, and it was impulse driven. But now they're labeled as a bully. So it's my job to help tease out, wait a minute, what other symptoms does this child have? Because no one point makes a line. You need 2 and actually several others. But that's where I come in to say, this kid is doing an awful lot of other things that are in line with ADHD. Maybe this is something we should consider. All right. But the hyperactivity is what gets that kindergartner or less, 1st and 2nd grader in trouble. And if I have any friends who teach those grades, you will be able to say, yep, that is certainly it. Now, what happens in 3rd grade? Now, if you listen to my first talk, you learned all about me and learned that I wanted to be a teacher initially. And so as a teacher, I'm certainly not one now, but I have a lot of teacher friends. And so what I have noticed over the years is that at about 3rd grade, there's this mad dash to see me again in December because a lot of kids are risking failure. Well, what in the world is happening in 3rd grade? In 3rd grade, I found that the majority of my patients are no longer running around the classroom, hanging from the light, fixtures. They are sitting in their chairs and not moving, but their brains still are. Also in 3rd grade, and my educator friends are probably going to get me if I say this incorrectly. But what I think is happening is that in 3rd grade, you are no longer learning to read, but you're reading to learn. Well, you're going to say, well, Dr. Brandi, that sounds the same to me, but it's quite different. When you're learning to read, see Jane run. Yay, teacher gets so excited. See Jane run, yay. Well, in 3rd grade, The teacher may say, well, how is Jane moving, class? And all your kid can say is, see Jane run. But the teacher just wants that child to say, Jane was running, right? So we've got a kid who's not paying attention. They are reading, but not comprehending because they're really not listening. And so they can't answer the question. But they're sitting there and they're a nice little kid and they're cute. They have their bows and nice haircut and everything is awesome. And what those teachers said in kindergarten, first and second grade, this third grade teacher isn't complaining about that anymore until December when she pulls you in and she says, well, Mrs. Mom, well, Mr. Dad, we're not doing so good. All right. And they start talking about retention or failure even as early as December. I've had some patients to come in with that problem. So third grade, we then switch to the presenting problem being inattention. So K1 and 2, hyperactivity. Third grade, we start talking about inattention being a big problem. And then what I have noticed is that the odd grades throughout at least elementary and middle school can be problematic. So third, fifth, and seventh grades are very difficult for my patients. All right, so we got them through third grade. Well, then what happens? Third, fourth, and fifth, they may coast along, and then somewhere between the end of sixth and seventh grade, we get into another problem. Several things happen at about seventh grade and up. You get more freedom from your parents because you're older. They expect you to be able to behave yourselves when you're not in their presence. They trust you a little bit more. So now you're around your peers. You're able to make better decisions, you know. So there's a lot of freedom that comes with seventh grade. But if you're not hanging around people who are like you and who have been raised in a way that your parents are trying to raise you, then what happens is you can get into impulsivity being a problem. And I call this the age of drugs, sex, and rock and roll. And I don't want to spend a whole lot of time on it here, but just to give you a snippet, because I'm trying to give you everything I know that parents want to hear, so they'll come back the next time. Parents always say, and remember, I educate, I don't force. Parents always say, I don't want my kid to end up on drugs, so I don't want those medicines. Research has consistently shown, though, that it is the child with untreated ADHD who is much more likely to get on drugs than those who are not. Research has consistently shown that it is the child with untreated ADHD who is much more likely to get on drugs than those who are not. And if you ever show me a child who is on drugs, and yes, that happens. I work at a facility that treats adolescent girls with dual diagnoses. So they have both a mental health disorder and a substance use disorder. And they most certainly do all sorts of things. Whatever adults are doing, they are doing it. And whatever adults are doing to pay for their addiction, they are doing it too. And if you ever show me a child and tell me about the drug that they use, I can almost tell you what their mental health issue is. And so, yes, a lot of times children who have ADHD and it is not treated, they will find themselves using things like cocaine and methamphetamines. Okay? So, I'm not telling you what to do. I'm just relaying information to you. All right? The other thing, and as I was saying that, I was thinking this. The other thing that happens about the time of seventh grade and up is that coming to see someone like me is no longer a hot thing to do. So you've got someone now who may be hanging out with a crowd that is not a good crowd, and they no longer want to take their medicines. And so, or get treatment, because I don't want to act like medicines are the only treatment, but they don't want to get treatment. And so now we're in a situation where they are much more likely to be vulnerable. They start driving. I can't tell you how many of my kids, you know, they are driving and they are running red lights. They are speeding and they are running people off the road, having wrecks. Why? Because they are impulsive. All right. So we want to make sure that we are aware of that presentation. K1 and 2, hyperactivity. Third grade to about seventh grade, Inattention is the presenting problem, and it is the one that causes the most problems for them academically. And then 7th grade and into adulthood, we have impulsivity being the main presenting problem. Now, I do not want you to get confused and believe that Dr. Brandi is saying, oh my goodness, my kid is just gonna, get into the 10th grade and we won't have this problem with inattention or impulsivity or hyperactivity. They all overlap. I just want you to know that this is what I most commonly see as far as when they come in and come to me. I hope that was a little bit helpful for you. I'm not going to take up a whole lot more of your time. It's a Sunday afternoon and it's beautiful. But I do want to just share some knowledge. That's all I'm doing. Hey, Emily. Hey, Auntie Brenda. Hi, Tyree. Hi, Miss Lovey. Hi, Joy. Thank you all for joining me. All right. So, what causes ADHD? Because remember, I said that it's nothing you've done wrong as a mom, as a dad. But we do know that there are some things that can cause or lead to symptoms of ADHD. Those include prenatally. So if we have alcohol exposure or cigarette exposure when we as moms are pregnant, that can certainly lead to ADHD. A lot of times fetal alcohol syndrome, one of the co-occurring diagnoses or even the things that can be symptoms that can be present could be those symptoms consistent with ADHD. So if you know a mom to be who is pregnant and she is drinking or smoking, please ask her to stop if you know her like that. Again, you're not going to see me walking up to people telling them. So if these people are your friends and loved ones, I'm relying on you to do that, okay? Cigarettes can also cause low birth weight, and low birth weight can lead to all sorts of problems in and of itself, much like consuming alcohol. So, again, get with your primary physicians, your OBGYNs, but make sure that we're taking care of ourselves when we are pregnant or when we have a loved one who is. So environmental toxins like lead and pesticides, most things that we are going to encounter in our environment no longer have lead. If your home was built before 1978, lead may be in the paint. So if your child is a mouther, you've got a crawler who has not figured out how to not put things in their mouths, and you have chipped paint that is chipping, then that may be something that you want to see about doing that. But no paint these days has lead in it, and of course our gas is unleaded as well. So that's not going to be something that we will encounter a lot, but do know that lead is still in soil in some places, and of course in houses. ADHD has a familial presentation, which means that moms and dads have it. So I can't tell you how many times I'm talking to the parents about their kid, or I'm just asking the kid questions because I do that. And the mom and the dad will say, you're describing me. And I'm like, yeah, 41% of moms and 51% of dads who have children with ADHD, they actually give it to them. And it's okay because it can be treated and you can go on and become successful and do whatever it is that you would like to do in life. But just know that there is a familial component. Siblings have it as well. So usually I'm treating an entire family, the kids, not the parents. I try to not do parents. We talked about premature birth weight and low birth weight, prematurity and low birth weight. Genetic, there is some dopamine problems. So dopamine is involved with all sorts of things. Movement. So people with Parkinson's, for example, have too little dopamine. Dopamine is involved in our sleep. Dopamine is involved with attention and learning and mood. Dopamine is involved with excitation. So us getting excited about things. So it's very important. And that's not necessarily anything anyone can control. It just kind of happens. And then trauma. So a lot of times people who have frontal lobe injury, they will have symptoms that are consistent with ADHD. Just a little bit. And I'm sorry, y'all. I just kind of go off and start talking about other stuff. But I get so excited about ADHD because I want people to understand that ADHD is okay to have it. But we have got to be aggressive about treating it so that we don't have our babies in a situation where they are being labeled. And I know that people say to me, I don't want my kid labeled. But here's a secret. I'm going to tell you, don't tell anybody I told you. Your kid is already labeled. with something, because the teachers know this child can't stay in their seat. This child can't complete a task. And then in high school, this kid turns in the parking lot on 2 wheels every day. They are labeled. But don't tell nobody. All right. Frontal lobe injury sits right there in the front, as its name implies. The frontal lobe is who we are. The frontal lobe tells us go, slow, stop, no, back up, danger, okay? And so that part of our brain is one of the very last to develop fully, all right? So the other thing about those adolescent kids, they're now free from you. They're hanging out with friends. Coming to see me is no longer a good thing. That's not sexy anymore. That is not cool. And their frontal lobe is not dangerous. Now, you don't have to answer the question, but I know some of y'all watching, not the ones I've named, but some of y'all out there in Facebook Live land did some pretty silly stuff as adolescents. And that's what we're supposed to do, okay? But now you add ADHD to that, you've got trouble. You've got trouble that when the people call me, I may not even be able to get them out of. And oh, by the way, I have been asked by insurance companies, does this child have ADHD? Are they taking their medicine? I've also have children who have to get forms filled out for me by the state in order to be able to get their driver permit. So just keep all of that in handy because it's also related, okay? Frontal lobe, it is who you are. If it gets damaged, you are not going to be yourself, potentially. You may still be yourself. It is the part of the brain that inhibits us, okay? It tells us don't do that. That's a bad idea. When that area becomes damaged, we are disinhibited, which means that all inhibitions are off. So all is a go. You do not want to be that person as an adolescent with ADHD. I hope this is helpful for you all. All right. What does not cause ADHD? Very, very, very important. What doesn't cause it? Too much sugar. Now, my dentist friends tell me too much sugar is bad for your teeth. They say you ought to drink sugary beverages through a straw, all of that. My adolescent and pediatric friends tell me too much sugar is bad for your weight. And I see I thought I saw my coach on here, my fitness coach, Coach Shaniqua. So she would say, yeah, too much sugar, you don't want to do that. But for me as a child and adolescent psychiatrist, I hate to tell you, but the research has consistently shown that too much sugar really doesn't affect ADHD. So stop the kids from taking sugar so they won't be overweight and their dentists will be happy. But as far as their ADHD, they're still going to be having ADHD symptoms. They just won't be overweight. And that's okay. That is okay. Too much TV doesn't cause it. Now, the American Academy of Pediatrics has come out with guidelines about TV and limits about TV. And I'm going to just be honest with you. I'm a pediatrician. I'm a child and adolescent psychiatrist. My kids watch TV because guess what? I'm working from home now. So the only way that I can continue to see your kids is that if sometime my kids are watching TV. Does that make me a bad mom? Not at all. And if I am, I'm going to have to pay for it. But no, they watch TV. And in fact, much more than what I recall from being a young child, the things that are on TV now are quite educational. I learned things. I thought a diamond was a diamond until I learned that it's actually called a rhombus. And I was like, is this a new word? So the things are educational now. Make it educational and make sure that you're engaging with your children when they're watching TV. If they're watching it more than they're talking to you, that may be problematic, but I'm not here to judge. Everybody is out here trying to make it, especially while we're in the middle of coronavirus and everybody's working from home, churching from home, playing from home, living from home, breathing from home. We're doing it all from home. These are hard times. So if your child has to watch TV, strong work. You made it through the day. Everybody is alive. Good job. Now, people talk about bad parenting. That child just needs a whipping. All right. You don't have to raise your hand. But if you've tried to whip ADHD out of your child, I understand. But it doesn't work. It doesn't work. But I'm not going to force you to treat your child's ADHD. I'm just going to educate you about the fact that it doesn't work. And I wish I could use both my hands so that I can show you. But imagine, I'm just going to use this little area here. Okay. This is in a child with ADHD. This is their working this is their executive function, all right, their ability to get things done. So when you say, didn't you recall that, or didn't you remember, you're asking them to go over here outside of my little box and recall something. They can't do that. Or if you say, didn't you imagine that, you're asking them to go over into the future, bring something into the box from the future. They can't do that. See it, do it, done. Oh, mommy, I forgot. So they really do forget. Parents will be like, he can remember the password to my phone, but he can't remember that homework assignment, because the password to your phone is exciting. Great things are in store inside of your phone. If they can't focus, there is nothing great about reading that book. It's not exciting. All right. Now, when we talk about bad parenting, there are definitely some people who parent more effectively than others. I don't like to say bad parents, because some parents are tired. By the time you get off from work, and Dr. Brandi just likes to keep it real. I am the keep it real doctor, because guess what? I have 3 of my own. They are 5. One will be 4 this month, and the other one is 1. You are tired. I told my husband one day, I just don't want a mother right now. Anybody ever not wanted to mother just for a moment? Hi, Kimberly. Hi, Angie. Hi, Bernadette. Thank y'all for joining. Sometimes it's just overwhelming. And then you got a kid running around. Oh, my goodness. Whew, it's a lot. But we have to do things. We have to set boundaries. Okay, we have to set boundaries. Kids love boundaries. They will never tell us, but they love them. They need boundaries, and so do we. They need good bedtimes. They need to know what the rules are of the game of life. We are always whipping these kids. We want to whip them and whip them and whip them and yell at them. But we changed the rules of the game, but they didn't know. It's like Uno. Y'all ever play Uno with people that are changing the rules? Like, oh, we ain't playing like that the last time. The kids don't know. We changed up the rules. Now we whipping them. And so somebody's probably thinking, well, Dr. Brandi, is it okay for me to whoop them? Because I be whooping my kids. You probably ought to check with your states, because I see we've got folks from several states. You probably ought to check with your state's rules on spanking, whooping, beating, opening up a can of whatever, to see what the rules are. But here in Alabama, you cannot leave a mark. Okay. I will also add this from a professional standpoint. If it's working and it is within the rules of your state, then by all means continue to do so. If it's not working, you need to change it. And that's just with anything that you have as a behavior modification. If it's not working, change it. All right. Behavior charts are awesome. We'll spend some time going over that. Speaking of which, if y'all just want to drop some comments in the messages about what you like me to talk about, I'll be glad to do it. That actually helps me, because I always feel like I'm boring people, and I apologize for that. So what does not cause ADHD? That's what we're talking about. Too much sugar, too much TV, bad parenting. And if you're coming in at the end, I hope you'll have a chance to go back and listen from the very beginning. Poverty. Poverty does not cause ADHD. Okay. And I'm just going to leave that at that. But it does not. And family chaos does not. Chaos does not either. Do sometimes those things, though, lead to ineffective parenting, because parents are overworked, they don't have any help, they don't have resources. Absolutely. But just being a child in poverty, or just being a child who comes from a lot of chaos in the family, does not set you up to have ADHD. All right. Okay. I think that is all I have for today. I certainly will hang around and be looking in the chat to, unless somebody takes me a question, I'll go ahead and answer a question. If anybody has to answer a question now for their friend, I will go ahead and ask it now. Otherwise, I am going to let you all enjoy the rest of your Saturday. I do appreciate you so much for watching, and I hope that you learned a lot. So I will try to do these weekly. In fact, I will be doing these weekly. This session today was just understanding ADHD, what it is and what it isn't. And just for a recap, I'm going to go back. It is a neurodevelopmental disorder, which means that it's neurologic and it's developmental, and something, I'll come back to you, Kimberly. I'll come back and address that real quick. So something has just gone awry. I mean, seizures are a neurologic disorder. We have so many things. And so if you can think about it as being something that it's just an unusual way of developing, then that's gonna make you be so much more at ease with treating it. I see my good friend Dr. Leisha Ellis Cox just loves something, and Dr. Leisha Ellis Cox talks a lot about mommy guilt. Okay, we as parents, we have so much guilt. And we actually should not do that to ourselves. We would treat our kids seizures. We would treat our kids diabetes. We would treat our kids whatever. So if your kid has some ADHD, some anxiety, whatever else, let's treat that too. Let's set these kids up for success. Let me stop. I'm going to keep going. 3 types of ADHD. Inattentive presentation, hyperactive impulsive presentation, combined presentation. Who does it affect? It can affect everybody. Blacks and whites are actually about equal in the percentages. Males more than females, but remember that it's going to be your males are going to present more with hyperactivity. So hyperactivity is going to get picked up quicker than someone who's just sitting there and their brain is moving around. All ages, okay? All ages can be affected, and is 3 years old. The youngest a child is diagnosed. I have diagnosed a 2-year-old. That is unusual, just because they don't come to me. Usually at the point that a child comes to me, parents either have a very strong clue that something is going on and they are ready, or they just don't come. But yes, I have treated a 3-year-old. Average age of presentation 3 to 6, and again, that's because they're going to school. And people are trying to teach them. These are the kids that at 4, 5, and even going into kindergarten, they still cannot recognize their alphabet. And please know that singing the ABC song does not count. You need to be able to have me show you an L and you identify it as such. All right. Type of ADHD, we talked about boys being more hyperactive, girls being more inattentive. Socioeconomic status, I missed that one, but all of them. I hinted on that at the end. 6.1% of children with ADHD are treated in this country. That's a very small percentage. It looks like everybody's got it. We want to say that everyone has it, but really only 6.1%. That's not a lot of people. There has been, and I left this out, a 42% increase in the diagnosis over the years. And I think that's just because we know what it is. We can recognize it, diagnose it, and treat it. And it goes back to those parents who say, you're describing me. Because what did we do back in the day? We whipped it out of you and we prayed it out of you and we just acted like it didn't exist. And, unfortunately, in the world we're living in now, so our parents could get some good jobs, that a lot of people actually do grow up and get jobs that fit with their level of ability to focus. I once met a city bus driver who said his feet could move all day. He could talk to people. He could see different faces. He got different scenery. It was perfect for him. That person might not make it as a librarian, though. So we just need to consider that. We talked about how it changes over time, and we go from hyperactivity being the main presenting problem, K1 and 2, to 3rd through 6th or 7th grade, and attention being the main presenting problem because they're sitting still, but their brains are still moving. And then 7th and up, we start getting into troubles, drugs, sex, and rock and roll, because impulsivity is the main presenting problem. We talked about what the causes were, prenatal things like smoking and drinking alcohol, environmental toxins like lead and pesticides. We talked about there being a familial presentation or risk. So 41% of moms, 51% of dads having it. We talked about premature delivery or birth, and also low birth weight, which is related to cigarette smoking. We talked about trauma in the frontal lobe, and the frontal lobe is what controls our ability to be us, to make good decisions. What does not cause it, I think somebody said that they missed that. Too much sugar, too much TV, being in poverty, family chaos, and quote, bad parenting. All right, I'm going to get out of here. I do appreciate you all's comments. I do appreciate your time. Feel free to post other questions and comments here. And I love talking about ADHD. Hopefully you can tell. So I will see you all next week. I pray that you all have a great, great week. Remember, I am Dr. Brandi B. Please follow me. Have all your friends to follow me. I am Dr. Brandi B on all social media. My Twitter and my Instagram have an underscore. I think it's Twitter and Instagram. Have an underscore between the I and the B, but my picture is the same. So you found me here on Facebook. Just look for that picture everywhere. And I'm going to be hoping to share all kinds of information with you all because I absolutely love this. And I love each and every one of you. And I want your children, grandchildren, great-grandchildren, nieces and nephews to all do well. And trust me, we need to be focused. We need to be focused in life, in the classroom, and everywhere else so that we can be the best that we can be. Dr. Brandi B, your triple board certified pediatrician, adult psychiatrist, and child and adolescent psychiatrist. Until next time, thank you for listening and watching, and bye-bye.